A little stomach pain and maybe some nausea could be more than just maybe a reaction from a bad lunch. It could actually be signs of something called diverticulitis.
Yeah, it's actually becoming more common here in the U.S. Roland Rodriguez is at Doctors Regional Hospital this morning. And Roland, let's talk about some symptoms here.
Hey, good morning, guys, and good morning, South Texas. One of the more challenging things about this disease, it's often not what it seems to be. Melinda Sanchez, a retired school teacher, was diagnosed with diverticulitis, a painful condition where infected or inflamed pockets form in your colon and can cause severe damage. Like many Americans, Sanchez had been dealing with some stomach pain for months, but dismissed it as normal.
I went to my personal physician and thought I had a urinary tract infection, and they sent me for a test because he thought it was diverticulitis, and the test came back immediately.
Signs and symptoms of diverticulitis include pain and cramping in the abdomen, fever, chills, bloating, nausea, and sometimes even loss of appetite. The treatment may be simple and uncomplicated, requiring 10 to 14 days of oral antibiotics, or it may require an extremely complex surgery.
So traditionally, we used to do surgeries of the colon with a large incision to help us take out that part of the colon. However, recently we have new techniques called laparoscopic surgery, and a version of laparoscopic surgery is robotic surgery. And basically the idea is, instead of making a large incision, we make smaller ones through which little instruments can help us do the surgery inside the belly and then help people heal up faster that way.
They told me I was going to stay in the hospital 3 days, and I only stayed 2. I had almost no pain afterwards. It was easy. It was a fast recovery.
And of course, if you'd like more information on the disease, all you have to do is visit our website at kristv.com. Reporting live from Doctors Regional Hospital, Roland Rodriguez, Chris 6 News.